Essentially, Climate HIV is a HIV clinic in a box. It's a specialized electronic care record system which lets us do all the parts of our jobs in the team to look after people living with HIV. We got a steering group together from very important people in the HIV field to advise us how we can develop a project together. And we found 6PM, an IT developing company with whom I've worked over the past year to develop a new version of Climate HIV, which is fit to be installed in any NHS trust. Climate HIV is modelled after the work streams of a busy clinician who sits in front of a patient and wants to concentrate on the patient. So every action that I do with a patient in the consultation, be it I ask them about their diagnosis, their problems, and document them, I change their medication, I look up a lab result, I write a quick letter, etc. All of these are only a few mouse clicks away. So I can really concentrate on the core of my job, which is looking after the patient. And secondly, there's a lot of tools in there to educate the patient. I can show the results of the patient to them in the consultation. Well, Climate HIV has been designed with teamwork in mind, because nowadays looking after an HIV patient is really a task that is shared by the doctor, the pharmacist, the nurse, the receptionist, and everybody else.
One of the benefits for the team working here, with the computer software, we have alerts on climate. So people can flag up things that need to be either mentioned to the patient or things that need to be done, flagged up for research studies. So everything is right there and people can leave notes for one another. Certainly before the software was instituted, I would have to get a pile of notes of patients, look through them to see if these patients even were initially eligible for a study, and that used to take an enormous amount of time. Now it's quick, it's easy, I go on the computer and not have to worry about that.
Climate helps us in communicating with our clinicians, it helps us verify our prescriptions, and it helps us track where the prescriptions are and in what process they are in terms of dispensing, collecting, counselling the patient, and also whether the clinician's written it or not, and also their run-out dates. Usually I would give the patient advice and that would usually be that. But with Climate, just because in terms of clinical governance and accountability, I'm able to then get on there very quickly, spoke to patient going on holiday, asked regarding this drug, gave this advice, and that's simple. And so in terms of a healthcare professional, it's safer, it's more in line with clinical governance, I'm more accountable for what I've said, and everybody knows now that the patient's going on holiday, they all know that the patient's on this specific drug, and they all know what the action plan is.
Climate HIV supports me in my role simply because it merges two databases, that is obstetrics and both HIV, for the care of clients which are HIV positive and pregnant.
Having Climate has made our life a lot easier in that paper records are virtually non-existent. I can tell at the click of a button when the consultants need to see the patient, when the dietitians need to see them, pharmacists, and I can also see all their latest blood results, so I know how urgently a patient needs to be seen.
HARS is the HIV and AIDS reporting system, which is a new reporting system to Public Health England. It is there for purposes of epidemiology, so we know how to plan for the HIV epidemic in the UK, but it's also there for payment. So my hospital gets paid according to the report that we submit. Now, we've been happy to design Climate HIV around the new HARS data set, which means we were collecting those data whilst the clinician is doing their work. HARS is now submitted every 3 months, and that is in contrast to SOFIT, which is the old reporting system, which had to be done every 6 months or once a year. And if we wouldn't have Climate HIV, this would be a big burden, and I would have to employ an extra member of staff just to collect the data.
I think the implications without the climate system would actually be massive on the trust, because it would actually deter from sort of sensible planning, financial planning, whereas now we've got an accurate figure that we can actually forecast what the spend's going to be. to the end of financial year. So for planning purposes, it's very useful.